The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Very important, guys, to start slow, go steady. No, it's not a fast race. We're all in this together.
There's a lot of anxiety, depression, and PTSD going on. So just need to make sure that our message as a provider is heard by our minority patients. Making sure that we are here for you.
Welcome to Mindful Moments with Pedro Morante. We would like to discuss about eating disorders today, and a lot of you may relate to this very important topic. So when people think about eating disorders, we often picture somebody who is very thin or very frail, someone whose struggle is not so obvious. But in reality, many people who are struggling don't look that way at all. And in line with Eating Disorder Awareness Month, we wanted to open up this conversation, especially for those who are feeling unseen. Because the truth is, you don't have to look sick to be struggling. And to help us uncover that, we're very grateful for today for this very special guest. And she agreed to join us today. Eating disorder, OCD therapist, and host of the Body Justice podcast, Miss Allyson Ford, in the house, guys.
Thanks for having me. I'm so happy to be here.
Thank you, Miss Allyson, for taking some time in joining us today and collaborating with this very important topic, especially it's Eating Disorder Awareness Week.
Yes.
And I'm actually going to start with something a little different from my previous podcasts. Okay. I'm going to throw a few quick questions and then just things that people might experience from day to day. And you tell us, is this something we should pay attention to? Okay. Are you ready?
Okay. Mm-hmm.
Number one, is it normal to feel guilty after eating?
No.
Skipping meals because you're busy?
No.
Checking your body in the mirror often?
No.
Do eating disorders only affect young women?
No.
Do you have to look underweight to have an eating disorder?
Nope.
And is it possible to be struggling and not realizing that you have an eating disorder?
Yes.
Thank you so much. Now, so those are various things or questions that might seem very small right now, but are actually worth paying attention to. So, Miss Allyson, let's uncover this and unpack this. For someone hearing this for the first time, what exactly are eating disorders?
Yeah, thanks for asking that. And I think those questions that you just asked me are really important. And I guess I just want to say something about that quickly. The first three that you asked about, is it normal if this happens? And I want to say that it is normalized in our culture, but it is also a sign of disordered eating, right? So that's something we'll get into more in this episode. But so much of what is actually eating disordered is normalized by the culture, which is one of the reasons it can be so hard to spot. But in terms of what actually is an eating disorder, so the symptoms of an eating disorder will show up as a preoccupation around food or body. But that is just the like tip of the iceberg. I like to tell people to think of it like an iceberg, where at the very top, what you can see is this obsession with food and body. But underneath that is a lot more. They have eating disorders are biopsychosocial mental illnesses. They also have political and environmental influences there. So they're really these multifaceted illnesses that affect your mental health, but also your physical health. And, you know, the most common ones we hear of: anorexia, bulimia, binge eating disorder, ARFID, OSFED, which is basically just you meet most of the criteria for an eating disorder, but not all of it. But that doesn't mean it's less severe. Actually, most people with an eating disorder will be diagnosed with OSFED, which is other specified feeding and eating disorder. But people can have just as severe medical consequences with that as to compared to like full-blown anorexia or bulimia. So I just like to note that, because, you know, diagnostic criteria doesn't always capture the severity and the suffering of someone.
And thank you for uncovering and also emphasizing those important criterion for the DSM-5, and also looking at the most common types of eating disorder. Now, according to the statistics, there is 1 in 5 people, or about 20%, will experience an eating disorder or significant disorder eating symptoms at some point in their life. And approximately an estimated 30 million people will experience a clinically significant eating disorder during their lifetime. Now, we want to follow up with that question, like, how do eating disorders usually start?
Yeah, so there isn't one specific like universal way. Everyone's story is a little different, but what I will say is one of the most common ways is through dieting of any kind. Any type of food rule, or any type of, you know, people hear the word diet and they'll say, well, I don't diet, but it's a lifestyle, right? But unfortunately, like, wellness culture has repackaged what dieting is. And so what I tell people is it's like any rule you have around food, whether that's the type of food you eat, the amounts you eat, when you eat them, anything that can trigger an energy deficit, which is a, you know, buzzword that we hear all the time as if it's this good thing. But anytime that happens, a person predisposed genetically to an eating disorder can develop a full-blown eating disorder. So that is one of the biggest gateways. That's what happened in my own recovery journey. Yeah, so you got to think of it as like someone has genetic makeup for an eating disorder, and then something in the environment kind of pulls the trigger. And oftentimes it is that energy deficit from any.
Right. So these are could be considered as like rigid rules that they have.
Yeah, any type of rule around food, any you know, let's say like things like intermittent fasting, right? That is just disordered eating. And I know a lot of people will fight me on that, but it's true. If you are creating rules around what time of day to eat and how much and when and all of that, that falls into that umbrella. And I'm not saying everyone that intermittent fasts or does some type of dieting will develop an eating disorder, but I'm just saying it is a risk factor. And so if you have eating disorders in your history or in your family history, you have to be really mindful of anything like that. The other thing that eating disorders often come from trauma too, someone experiencing something really traumatic, and then food becomes a way to like stay in your window of tolerance, whether that's through restriction or purging or binging. And then also different neurodivergences. So people who are autistic or ADHD who have like sensory sensitivities, sometimes the types of foods you can eat becomes like a narrow window because of those sensory sensitivities, which then can trigger eating disorders too. So there's not one way, but dieting is probably one of the most common ones I see.
Thank you. So it might start from dieting, and then they're trying to eat healthier.
Mm-hmm.
And that could be a response to their stressors, anxiety, or trauma, or their desire for control, right?
Yeah, so I always like to make the distinction that like people with eating disorders are not like inherently controlling. I think that is like a common misconception. But really, it comes from a place usually when you feel you have no agency in life or what's happening to you, right? And so then you cling to a sense of agency and control to feel safe, not because we actually want to just control everything. Most of us grew up in environments where we are like overly scrutinized, overly controlled, and so it becomes this way that we do it to ourselves to feel safe. Yeah, that's a big component there.
Thank you. And what are the most common types of eating disorders?
Yeah, so the most common type, and this sometimes surprises people, is binge eating disorder. Um, Unfortunately, we get we hear about binge eating disorder the least amount, right? Like when we think of eating disorders, we usually think of anorexia or maybe bulimia. But binge eating is something that is so stigmatized and shamed by the culture that people don't talk as openly about it. Um, and it's also just often seen as like a willpower thing. I mean, they all kind of are seen that way, but I think binge eating in particular, people are just like, well, if you just had more control over your food, this wouldn't be a problem. So binge eating is very common. Then, anorexia, bulimia, they're all pretty common, but again, binge eating has shown to be the most common.
Great. So we have anorexia nervosa, right?
Mhm.
Bulimia nervosa, and the most common one among these three is binge eating disorder. Are there any distinction between these three classifications for those who are new to this eating disorders?
Yes, absolutely. And I'll get into that. And also, I'll say there's also ARFID, which is less talked about, but very, prevalent. But so in terms of anorexia, anorexia is like an extreme pattern of restriction with the desire of like lowering your body weight. So that looks like some people think like, oh, you just like don't eat if you're anorexic. And that's not true. It's what you eat is very limited and very controlled. There's usually a ton of rigidity, a ton of food rules. Yeah, it's very rigid in that way. And then bulimia involves this cycle of well, it really starts with restriction, but then it leads to binging and then purging. And purging is kind of the hallmark of bulimia, and that can be either through self-induced vomiting, that can be through laxative abuse, that can also be through over-exercising. So it doesn't just have to be vomiting. And so that's another kind of reason why that one can get missed. And that one specifically, binging and purging specifically is one of the most risky eating disorder behaviors. Your heart can stop at any moment that you purge, that you intentionally purge. So it's a really, really serious, they're all serious, right? But it's a very risky one to be engaging in. And then let's see, binge eating is when you eat like really large quantities of food that don't add up to like your energy needs. So like you eat beyond fullness, right? Usually to the point where you're in pain. And it's a pattern. It's not just one meal or one day or even a week. It is a pattern like over months, this sort of cycle that you get in. And there's a lot of deep shame and isolation that comes with it. So it's a lot of people be like, oh, yeah, like I binge eat on Thanksgiving every year. Well, that's not really binge eating, right? Like binge eating is a pattern. It's a mental health condition. Oh, and by the way, with binging, I also like to note that it happens to people of all body sizes and shapes. A lot of people think that like if you binge eat, you must be in a quote unquote like big body, but that's not true. It happens to all sizes and shapes. Same with anorexia. People think it's just a thin person issue, but only 5% of people with anorexia actually achieve an emaciated body. So there's a lot of misconceptions. And then ARFID is an avoidance of food due to a feared consequence. So like a fear that the person will choke or vomit and they don't want to, or sensory sensitivities. So again, like when there's co-occurrence of autism or ADHD, person may not be able to tolerate certain foods because of the way they taste or the texture, and that can sort of inadvertently lead to a restriction level that malnourishes the person.
Well, I'm learning so much today, especially the RFID, right? So RFID stands for Avoidant Restrictive Food Intake Disorder. Is that correct, Ms. Allyson Ford?
Yes.
Okay, great. And that's something that is not so common, but it can also affect your sensory issues. And you have low interest in food, and you have fear of
Mhm.
cooking. Am I correct?
Yeah, you don't have
Oh,
to have all three of those things, but it's either usually the feared consequence, so the choking or vomiting, or it's the sensory aversions. Now, a person could have both, but you could also, most people might just have one or two. Um, so, yeah, and sometimes there's trauma in that history, like maybe the person has choked before, but sometimes there's not. Um, and it can overlap a lot with autism, ADHD, OCD,
mm,
but it can have just as severe like health consequences, just different reasons as to why the person's restricting, if that makes sense.
thank you for that. And now, before we dive deeper and with our conversation, our audience and our followers of this podcast would like to get to know you also, Alison. So, what led you to this passion of treating patients with eating disorders?
Yeah, so it was really through my own journey. I developed anorexia in my late teen years. I, struggled for a long time, never thought I would get better, felt really hopeless, tried many different like therapies and things like that until eventually I found the right therapist for me and dietitian and went through recovery process and also like admitted to myself that I had a problem, right? Because again, there's all these reasons as to why that doesn't happen. So for a long time, like I just sort of suffered in silence. But really, when I went through my own recovery and finally got to a place of stability and healing, I started feeling really passionate about helping other people because, again, I didn't think it would happen for me. And so it's just very meaningful to now help people who were in the like shoes that I was in, right? Like feeling really hopeless and stuck. It is a very scary process. So it's meaningful for me to do this work.
Yeah, is your live experiences had led you to your passion to help other people. And that's something that is amazing in what you do because you're able to at least guide your patients on their journey because you were once on that shoes, right?
Yeah.
Now, a lot of misconceptions about eating disorders, and a lot of people they don't want to talk about eating disorders a lot. And what do you think are the primarily reasons for this?
Yeah, so there's so many reasons for this. I think number one, there's a lot of misconceptions about what eating disorders are, right? Kind of like we talked about, like if you don't fit this sort of stereotypical image of an eating disorder, um, it can be hard to feel validated that that's actually what you're struggling with. And so then sometimes people fear speaking up because they're worried they're going to get invalidated. And oftentimes they do. Oftentimes people will get invalidated. So it's not just something like made up in their mind. Society doesn't know how to to treat and identify people with eating disorders because our society is so entrenched in things like diet culture. So misconceptions, stigma, right? Like no one wants to admit that they're struggling with a mental health condition. Like the way that we see people treated that have mental health struggles isn't great, right? Like even if we personally believe in like mental health, like justice and liberation and stuff, the vast majority of people are still treated really poorly in society when you say you have a mental health struggle. So people will avoid it because they don't want that layer of stigma and judgment. Um, Another one is so with anorexia specifically, there's this effect, and I might butcher this, but it's called anaxnosia. And it's this thing that happens in your brain with chronic restriction where you have really low insight. Like there's almost this amnesia type of effect where you can actually look really ill. And again, you can you can be ill and not look ill. But what I'm trying to say is like you could have all the pointers that you are sick, but because of this thing that happens in your brain, you don't see it. It's like really low insight. And that's something that happened to me as I was at like my smallest and very sick, and I still didn't think I had a problem. I was in shock when people would confront me with that, because I just really didn't think that was me. You literally don't see yourself accurately in the mirror, or just, your conceptualization of yourself. So there's these effects that happen at the brain that also change the way you see yourself. And then, of course, the stigma from society, the misconceptions about it, I think all those things play a really big role.
And eating disorder can be very serious, and they could end up having electrolyte imbalance, dehydration, or severe starvation can lead to life-threatening complications. So why a lot of patients or people wait to be treated?
Yeah, well, a bit, so many layers there. One is the lack of access to quality care. It really takes a specialized therapeutic and medical team to treat eating disorders. There isn't typically classes on eating disorders in med school. Maybe there's like a day, right, or half a day or whatever, but there are significant medical consequences that happen in the context of eating disorders that the mainstream medical community isn't trained on. And it's the same in the mental health world. Most therapists are not trained on eating disorders. It's not something that's really covered in grad school in depth. And so lack of access to care is one. And then a lot of times when people do seek care, they might be met with invalidation, because one of the tricky things with eating disorders is a person can be really suffering, and it may never reflect on their labs, or it only reflects when they are literally about to die. So you can be struggling for a long time and like consistently show normal labs. I mean, that was my experience. It's many of my clients' experience. I remember I had like a low heart rate, but the doctor was just like, "That's great. It's so healthy. You have a runner's heart." But in reality, I was so malnourished that my heart was beating slower. It wasn't for a healthy reason. So we live in this culture, again, that like glamorizes weight loss at any cost. And so I think that really stops people from seeking care, because they don't even think it's a problem, / they do go in to get care and they're given praise. So it's really tricky. I also think that it can be hard to admit you have a problem and commit to trying to give up the eating disorder, like trying to heal it, because it likely protected you from something. I think of them as like coping mechanisms for deeper pain. And so just like, someone with substance abuse, it's doing something for the person. And so it's very hard to commit to change before you know what that is and before you have other coping skills there. Yeah, those are some of the biggest reasons I would say people don't reach out for help.
And it's always important to tell them that there's help, right? Because a lot of these patients, they have this imposter syndrome that nobody can help them, or there's like negative thoughts that we need to reframe or rewire with the way they think, right?
Mm-hmm.
Good. Now, most people with eating disorders are not underweight, right? So, what are common stereotypes that people perceive eating disorders look like versus how it really looks like in reality? So, can we identify at least top 3 stereotypes about eating disorders patients?
Yeah, I think that some of the top stereotypes are that it is like a thin, white, teenage girl issue, someone that comes from wealth, and is heterosexual, cisgender, like basically the peak of privilege, right? But in reality, trans people, for one, have some of the highest rates of eating disorders, more than cisgender people. BIPOC people, Black and brown people, have higher rates of bulimia and binge eating disorder than white people. People all across the spectrum of age get eating disorders. It's not just in your teenage years. A lot of people get them in midlife and beyond. Yeah, those are some of the biggest misconceptions. And that's, I think, another reason why people don't seek out help is because if you don't fit that stereotype, right? Um, you fear being, A, you may just not even think you have a problem, but B, you fear being invalidated, or, there might be cultural components like around help seeking for people in marginalized communities. So yeah, there's a lot of stereotypes and they're just inaccurate.
Yes, and we want to at least inform our audience and followers that those misconceptions and also stereotypes are not true, right?
Yeah.
In reality, everybody could be affected with eating disorders, right?
Absolutely, yes. And I think to sort of harp on what you were saying earlier, yeah, only 95% of people with eating disorders are not underweight. So when we're going by that stereotype, we are missing the vast majority of sufferers.
Great. And it's all genders, all race, body size, and backgrounds are at risk for this.
Yes, 100%.
And now we're talking about words. Words are very powerful and can also be triggering for somebody with eating disorders. What do you think are the most common words that could trigger or could cause a lot of stress for our patients that are struggling with eating disorders?
Yeah, I love this question because it's, so rampant in our culture, these sort of marketing tactics around food and diets. But anything that labels food as good or bad, real food, clean eating, all those things, they create these like binaries around food and this morality attached to food. All of that can fuel eating disorders. Also, words that are meant to stigmatize people in higher weight bodies. So I know it's technically a medical term, but the O word, obesity, has been used to harm people in bigger bodies and is also, based on the BMI, which is really has a lot of problems. BMI is not like sound evidence. And so, or sound science. And so anything that sort of creates this morality around food or bodies is harmful for anyone struggling in their relationship with food or body. So in my work with clients, we work a lot on like learning to see food as more neutral, and not having labels like good or bad. That really fuels that rigidness.
Good. And very important words like you look like you've lost weight, right? Or labeling
Yes.
foods as good or bad. Those are things that we need to make sure be careful about. Or I need to burn this off, or I was so bad this weekend. Those are the most
Yes.
common words that we hear, and a lot could trigger a lot of stressors for our patients too, right?
Yeah, absolutely. That's a really, really good point. The comments on weight loss, like if you can do anything to not amplify eating disorders, just don't comment on people's bodies and especially not weight loss because you never know what's behind that, right? Like that could be an eating disorder or someone going through an intense loss that is struggling with their appetite. Or it could be a serious health condition like an autoimmune issue. Like it could be so many things that you are complimenting. So instead, if you have a concern, just ask the person how they're doing, right? Don't comment on their body.
True. And I just want to share that we really need to be mindful about this, like, especially during the holidays, right? Wherein we see our families and relatives, and those words could hurt them in such a way that they don't want to even attend any more of the events, family events, because it triggers them, right? When they hear those words about your
Yes.
body weight, right?
Yeah, and even like if it's not directly said to you, anyone that hears those comments, right? Like think of the kids in the room at those holiday events that are now hearing adults like comment on bodies, like that's where it all starts. So it's very important not to comment on people's bodies in any way.
Now let's talk about culture, and we're talking about family shape, and we touched on a little bit already. How culture and family shape our relationship with food.
Yeah, so this could be a whole podcast episode. Culture and family have such big impacts on our food. Culturally, we live in this very thin, obsessed world. There's a lot of pressure to lose weight. I mean, it's in we can't turn on the TV without getting an ad for GLP-1s or the next diet, whatever it is. Like, there's constant noise around it. Social media plays a role. And then different cultures have different meanings associated with food, right? So, or even like different sectors of religion have different meaning attached to food, and all of those. And I'm not saying that like that's all bad, right? Sometimes the meaning attached to food, like food being nourishment, food being something that's pleasurable, that connects us, those are meanings that are great. But there can also be more negative meanings that different cultures attach to foods, like sinful or just there's so many. But that's one way. And then in terms of family, like usually if you really dig into someone's family history, there is a pattern of disordered eating. It's very rarely like a one person kind of thing. Usually there's some sort of intergenerational pattern, and they might look different. Like, for example, in my family lineage, my grandparents grew up in like wartime Indonesia, and they fled Indonesia. They had food insecurity, meaning like they didn't have adequate access to food. And those did create some of their own struggles with food the rest of their lives, like being really conscious of not wasting food, like, eating past fullness because you like, otherwise you're wasting it. And like, but at the same time, don't be too greedy, right? Like all these messages that get passed down generationally. So I will say, there's typically a pattern. Also, dysfunctional family dynamics, families where there might be a lot of enmeshment or codependency, or like abuse and neglect, any of those sort of extremes, can create this sort of perfect storm for an eating disorder, where the person uses behaviors with food or body to try to gain approval, love, acceptance, or to just numb out their emotions. So definitely two very big components there.
And thank you for emphasizing the culture aspect. Family messages are very important. And over time, these messages can disconnect people from their natural hunger, fullness, and self trust. So we make sure that we identify those triggers so that we are not implementing something that can trigger us to have more eating disorders, like finishing your food because if you waste so much food, there's a lot of people that are getting hungry in Asia or in third world countries, so you end up like finishing the entire food wherein you're already full, right?
And then on the flip side, sort of being made to feel guilty too, like don't waste it, but also like don't take too much, right? Like it's just very, and like, I have so much empathy for people that, like my grandparents, right? Like that was survival to them. That wasn't intentional harm.
In terms of social media aspects, is this helping or benefiting, or at least causing more harm for our patients?
Yeah, I would say overall social media has been really bad for eating disorders. Eating disorders have skyrocketed along with the increased access to social media. People are comparing themselves to like these filtered images, these very curated feeds about body, workouts, food. There's tons of unhelpful misinformation and advice from really unqualified people who may not know they're causing harm, but definitely add to this just culture of thin obsession and comparison.
Yes, I agree with you. The social media aspect can spread awareness and recovery support communities, but also a lot of patients feel like they're comparing themselves, right? We're in reality versus expectation, and a lot of images right now could be due to AI, and also a lot of
Yes.
apps that could make them beautify their body image. So there's so much misconception that we need to really make sure to present reality for them too, right?
Yep.
Yeah. So unrealistic body standards could be there, or comparison and also diet culture and misinformation are out there. So we really need to be mindful of our sources.
Yes, absolutely.
Now, we talk about the reason why somebody has eating disorder, and we talk about the implications on their mental health. Now, how do we treat this patients on your standpoint?
Yeah, so eating disorders are best treated within a treatment team model. So that means having a specialized therapist, a specialized dietitian, and ideally a specialized doctor, possibly a psychiatrist, depending on the patient. But having those core three elements is really important because eating disorders affect our mental health. They affect our nutrition and medical needs. And so yeah, it's something that takes a village. And it's very important to get a specialist, especially when it comes to therapist and dietitian. Specialized doctors can be a little harder to find. They are out there. But there are informations on the, I can send you the link on the Academy for Eating Disorders. There's medical fact sheets that you can give doctors that say, these are the labs you need to get, or this is what you sort of need to look for. And that is better than nothing. But definitely want to get a specialized therapist and dietitian. Otherwise, if you get someone that's just sort of general, they may be entrenched in their own eating disorder beliefs, unfortunately. So because so much of the culture is sometimes therapists or dietitians who aren't trained or specialized will miss certain signs and they will respond to things that could actually be more harmful or triggering.
Yes, and recovery isn't always linear, but with the proper support and interdisciplinary team, then they'll be able to offset the symptoms and be able to find recovery. So medication can also be appropriate, and that's why we're also here as nurse practitioners, psychiatrists. And if
Yes.
you need to be on the higher level of care, there's outpatient, inpatient, and residential eating disorder treatment centers that they can be on.
Yes.
Yes, good. Wow, so there's a lot of information for today. What is one thing that our viewers and our followers can pick up and you're emphasizing on this session?
Yeah, I think the biggest thing to know is that eating disorders don't have a look. So if I think we should all be screening naturally, in our intake process, what's your relationship like to food or your body? Those should just be standard questions because we just don't know who is struggling by looking at them. And I think the other thing is to really take out any sort of weight-centric focus when you're working with clients. If it is not necessary to weigh them for a clear medical purpose, don't. Things like that I think are really important. But yeah, number one, they don't have a look, so you have to ask.
And thank you for emphasizing that. That's very important. We don't look how they look, but we also ask how they're feeling, and that's very important. They need to feel that they are seen and heard and validated.
Yeah, absolutely.
Now, a new section of our podcast talks about the categories. So these are 4 questions that I'm going to ask you. So there's emotions, mindful, inquiry, and expression. So which category would you like first?
You can start with whatever one you want.
Okay, we'll start with inquiry, okay? So
Okay.
bring up one question. What are some things you love about nature?
About nature. I love the trees. I think they're very calming and they are remind me, I don't know, they feel very strong to me, resilient. And I love the ocean too. Any body of water, really.
Great. And next one is emotion. So it says here, what is one thing you love doing that makes you the happiest?
I love, the first thing that comes to mind is my 2-year-old. I love him so much. He always makes me so happy. So I love just taking a nap with him. It's the best thing ever.
What is his name?
Amari.
Amari, okay.
Yeah.
Lovely name. Now, our next one is mindfulness. Okay. Why do you think it is important to be patient?
Well, because that's the way life is, right? Like there's no really other option. You will be constantly dysregulated if you're not. And this comes from, I'm a very impatient person. So I'm speaking to myself when I say that too. But yeah, it's kind of like the only choice we have.
Okay. Great. And the next one is expression. What is one thing you wish to happen in the near future?
Well, the first thing that comes to mind is to abolish ICE. I hope that's okay to say here, but I'm very bothered by the state of the world and the safety of our communities. And so that's something that is forefront for me.
Thank you, Allyson. Those are the 4 mindful talk deck cards that we have for you today. Thank you so much, Miss Allyson, for sharing your insights and the work that you do. Where can people follow you in your social media, in your podcast? You can promote it to our listeners and followers out here.
Yeah, absolutely. So my Instagram is at bodyjustice.therapist. And then my podcast is Body Justice. It's on Apple, Spotify, Google, wherever you get your podcasts. And then my website is www.eatingdisorderocdtherapy.com. And we see people in California, Washington, Maryland, Tennessee, Utah, and Florida. But we are based in California. So, yep, that's a little bit about
Your
us.
office is in San Diego. So can they see you in person or telehealth or both?
Both. Yep. So we offer both.
Yes. Okay. So for those who are tuning in here, we're gonna post her website and also her booking details in our link below on this podcast. Thank you so much. And to everyone that are listening out there, if you are experiencing eating disorders, always remember there is help. And do not wait until your condition gets worse. And we are always here for you. And recovery may not be straight or linear, but it is possible. And with the proper support, we are here for you. And Miss Allyson and I are going to be here supporting you with your journey. Once again, I'm Pedro E. Morante, the host of Mindful Moments, and I'll be seeing you on the next episode. Thank you so much, Miss Allyson in the house.
Thank you. Thank you so much for having me.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.